Hey guys, welcome back to Medical Coding with Blue. We all know what today is. It's Thursday. And what does that mean? It's Quiz Friday Eve. I'm a little bit excited about Quiz Friday, I gotta say, because I have been working on it, so I can't wait. So as promised, today I'm going to be talking about the injury aftercare, okay? Now, I'm going to talk first about a little secret, okay? We all know that injury codes start with an S, okay? A good way to remember that you are going to keep that injury code through the patient's care, right? Because we have the three phases. We have the initial or the active treatment phase, and we have the subsequent phase or the healing phase, and then sometimes we have a sequela, okay? But for the purposes of today's episode, I'm not going to mention sequela, okay? I just want to get the aftercare part right about the injuries, okay? So don't worry about sequela. We'll talk about it on another episode, all right? So now, a little secret that I have to remember when you have an S code or you have an injury code, right? That S stands for stay. You're going to stay all the way through their treatment. Anytime you see an S code, you know it's going to trigger stay. You're going to stay with that same code, okay? So, even after a patient has had surgery, let's just say, for example, they had an open reduction internal fixation of an ankle fracture, okay? We know that ankle fracture is going to have an S code. That's what all injury codes start with, is that S code. So it's going to stay all the way through their treatment, okay? So their initial visit or when they're being actively treated is with an A, okay? Now, after they've had their surgery and they're coming back for their post-op surgical check or whatever, that's when it's going to be the subsequent phase, the healing phase, okay? Because you're no longer in the active phase on that injury, okay? That injury has already been actively treated with the surgery or with the, the reduction or whatever they were doing, okay? I'm just saying surgery for a reference point, okay? But once they've gotten their active treatment, okay, then they are in the healing phase, the subsequent phase. So that's when you're going to have that 7th-digit character of D, okay? And you're going to stay with the injury S code all the way through their treatment, okay? Now, once they come back and they're out of the global period or their treatment has completed and they've done everything that they're supposed to do, and let's just say they're coming back for a follow-up, right? 6 months down the road, okay? Patient comes in, they're coming back to follow up from their fracture. Maybe they're coming in to make sure everything's okay because they want to try out for sports or something. So this visit would be where the Z09, the follow-up, comes into play. If there's nothing going on with this patient, if this patient healed perfectly from their surgery, right, for this ankle fracture, you would do the Z09 and then the history of a fracture code, okay? Because they no longer have a fracture, right? Unless, of course, there's something going on, but then you would code accordingly. But keep that in mind. S, when the code starts with an S, you're going to stay all the way through their treatment. Stay with that same code, okay? Now, please, do not do this, okay? Do not do where the patient had a surgery, right, for an injury, and then they try to code orthopedic aftercare or some other aftercare with it, right? For some other aftercare for, in conjunction with an injury code. If the surgery was for the injury, do not code aftercare in conjunction with the injury code, okay? They're going to know that this patient had a surgery because you would have to code 99024, which is the post-op CPT code, okay? That's how they're going to know, all right? And even if they're still say they didn't have any surgical treatment, and say it's just a sprain and they're treating them non-operatively and they're just putting them basically like in a cam boot or something, like just say for instance they sprained their ankle, okay, and they say, okay, we're not going to do any kind of treatment, we're not going to do it like as far as like surgery or anything like that, we're just going to stick you in a cam boot, okay? obviously there's no surgery to that, right? Because basically they're just putting on a boot. So you are still going to stay with that same injury code with the D at the end for all the subsequent visits, okay? Obviously the first visit or while they're being actively treated, that 7th-digit character is going to be an A. But when they've completed that part and they're basically, on the healing side, it's going to be that 7th-digit character of D. But we're always going to keep that injury code through the whole time, okay? This is why there's those 3 levels: the active for the A, the D for the subsequent, and the S for sequela, okay? As I said, sequela is on another episode. I love sequela. I do. Don't ask me why. I think because I'm fascinated by the things that can happen as a result of an injury. And I'm always fascinated when I see injuries that have long-term effects, you know what I mean? Like different things that happen. And I can spot it right away usually if I'm looking at documentation, and then I say, oh yeah, that's a sequela, or that's this, because it's correlating, that the documentation correlates that this symptom is related to this injury, okay? So, and in those cases, I get very excited. I'm like, oh, okay. So I code sequela, But again, not going to talk about sequela, okay? So, does that make sense to everybody? Is that clear as mud, right? So, just keep that in mind. That S is going to trigger your mind that you're going to stay with that injury code all the way through, whether they have surgery or not, okay? Stay. All right? And then only when they've healed and everything's clear and good to go. Obviously, if they're not having surgery, you're not looking at 90 days for those ones that are treated like a sprain, Obviously, if it's 2 months later or something after they've had their sprain and they're following up, obviously, if they're okay and they never had to have surgery or they're completely healed and everything's okay, then you can use the follow-up, the Z09, with a history of injury if it's a sprain, okay? And guys, keep in mind, look at those history codes. Those history codes are freaking awesome because there's so many of them, and it can tell more of the story. And if you can get as detailed as you possibly can, it's even better. And especially when you have to look at it, when you go back to it and you're like, oh, okay. Now, I want to stress something else of importance when it comes to injury codes, okay? It does not matter where you are coding at, right? Doesn't matter. If you can get as much information about an injury as you can in the documentation, or make sure that it's there and things like that, or educate your provider that it's important to get all the details of an injury. These injuries can be the result of car accidents, workman's comp claims, or maybe something happened at their house and they had an accident or something like that. Any accident is going to need to have as most detail as you possibly can get, okay? Because it's very important. You never know where that documentation is going to be very important, because anything could happen to these patients. And if you're looking at the documentation, you're like, okay, I want to make sure that I code everything appropriately. Am I picking up the correct codes? So just keep that in mind. It's all about those details. And while it may seem overwhelming right now, once you get into it, it won't seem as overwhelming once you get the hang of things, okay? And don't beat yourself up right now if it's still not making sense. Eventually, if you keep working with it, it will get easier, okay? It's just the way that it happened with me. There were things, like I said, that did not make sense to me in the beginning, but eventually I was able to get the hang of it, and now I love it, and don't have any fear. Don't fear things. If you don't know something, or if you need to learn something, don't fear it. Because once you get that fear in your head, it's sort of hard to kind of infiltrate that, right? Look at things with an open mind and curiosity, especially with medical coding. You want to make sure that you are being as curious as you possibly can. If you are in an environment with other coders, help to foster that curiosity. What else can we learn? What else can we improve on with coding? Things like that, It's very exciting to me. I get very excited about As you can see, I get very excited about it. But, so, like I said, clear as mud, right? So, I'm gonna wrap that up on that one, okay? Because I don't want to talk too much on that and ramble on. At least this way you guys know the meat and the potatoes of it, right? Is stay. That injury code is going to follow through whether they have surgery or not, okay? Stay. Good? So, today was a good day. Although I felt like I didn't do anything itis. I literally felt like that all day, even though I did do a lot today, in terms of education wise, because I had to finish the deep dive up, right? Which I had submitted it, and she kicked it back. She wanted it typed, and she wanted other things for me to add, which was fine, you know. And so we had a meeting this morning, and it was one of our infamous coder meetings. Not always my favorite thing to attend, but only because they're really long sometimes, and then we're usually like in a very small room, and yeah. So anyway, whenever we have those, it's not. Anyway, so, and it was long. It was like almost 2 hours. It was like an hour and a half. Of course, I'm being dramatic, 2 hours, but it's what it felt like was 2 hours. Okay, so it may as well have been 2 hours. So that was 2 hours sucked away of my day that I couldn't get anything done, except for just be there and present in the meeting. And then, like I said, I came back and I started working on the rest of those deep dive audits, because I just wanted to get them done. I literally just wanted to get them done. And I had been working on one of my favorite providers, one of his encounters, and I said, no, I need to stop, and I need to make sure that I am working on getting this complete, because the sooner I got those deep dive audits off of my book, right, the better off I knew I was going to be, because I still have 2 more to go. And I'm planning on doing at least one next week and then one the week after, so that way I don't overwhelm my boss by submitting them all at one time. But I really want to get them done, because, like, dude, we are already going to be in July, and I can't believe it, right? We're already going to be in July. That's crazy to me. So I want to get them done because September is right around the corner, and I want everything done before the fall, before, you know, we start getting into that time, because, you know, that's when I start trying to clear everything out that I need to clear out. So like I said, if I can complete my goal, which hopefully I can, you know, I can get it done, and, you know, it'll be all good. So yes, that was my day today in a nutshell. I'm pretty much doing all that. Oh, but I did get one question, and I'm probably going to repeat the question again on Q&A Tuesday, but I'll just go ahead and answer it now while I have it on my head. I did get a question from a viewer about how many records am I required to do a day. What is my quota? So, or by the hour. So by the hour, the average, okay, we run on averages, okay? Because there's going to be days, especially like today, I didn't get anything done, right? I literally didn't get anything done except for, you know, trying to work some fleetingly some of those encounters, but mostly I was doing the education stuff because it is a requirement. In my evaluation, it is a requirement. So that's why it's just like, okay, that takes priority. But so we have averages, right, of what we're supposed to do, complete. So if we average out, in a month, what the goal is, which the goal for me in my clinic is an average of 15 records per hour. So it's not too bad. It is possible to do. Some days I don't get anything done, and then other days I'm sitting there with 150 of them done. You know, so on an average, it's like 90 a day, right? So on those days when I'm a little bit low, you know, if they total up all the time and everything, and the total number, you know, I always meet or exceed. I always exceed the number of records I'm supposed to do. And I attribute that to training my providers very well so that I can fly through those encounters and still manage to pick up, if they have things documented, I can make sure that they get full credit for everything that they're doing. That's always the goal, is to make sure that you have a keen eye and look and make sure and see what it is that they're doing, So, but yes, it's like 15 an hour. So, but it's just an average. So, that's just the standards where I am. It's not the same everywhere. Some places, they'll have you code more or they'll have you code less. Some places it's 12 and some places it's 20. So I think a lot of it depends on the complexity of the cases too. That has a lot to do with it. So if you hear, gosh, 15, that sounds like a lot. It really isn't. I've been in places before where it was 20. So, or 22. So then you're like literally like, okay, gulp for air and then dig back in, and then gulp for air and then dig back in, But like I said, if your providers are trained well with documentation, then, it really shouldn't be an issue too much. And again, I have to bring up the fact that it is about time management. You have to be really good with time management. If you don't know how to do time management, you will get overwhelmed quite quickly. And I did get overwhelmed in the beginning. I'm like, oh my gosh, how am I going to get all of this done? And then I started concentrating. I'm like, okay, if I do this and I do this and I line this up here and I make this in alphabetical order here, I can just sort of, But for me, I don't flip to different providers. I will pick one provider and concentrate on them until I get that sheet complete. And it works very well. I don't like flip-flopping from clinic to clinic to clinic to clinic. I don't like doing that. I like to concentrate on, like, if I'm working on orthopedics, I will work on orthopedics. If I'm working on neurology, I will work neurology. Rheumatology, same thing. I mean, it's just whatever specialty I'm in, I will work according to how it's more efficient for me. Sometimes that's not always what supervisors like, but at the end result is what my supervisor wants. So it's just like, the first time I was just like, okay, well, this makes it easier for me to work. And I explained it to her because the way that she had it set up, it wasn't efficient for me. It was efficient for some, but it wasn't efficient for me. And I told her, I was like, I'm not trying to be difficult, but if you hear me out and you let me show you how this works for me, I'll show you that I can get everything done. And she was like, okay, I'll let you do it. And then sure enough, she saw that I could get everything done. So she was like, okay. So, I mean, that learning what makes you efficient will also make you better, because then as you efficiently get things done, you have time to work on ones that are more complex. Any providers that are more complex that need a little bit more time, cases that are more complex. Because in your career, you will see cases that do get quite complex, and you're like, oh. And then if you code for a level 1 trauma center, that has a lot to do with it too, especially if you're coding a lot of traumas, which if you're really good at injury coding is really good, because it'll make it much more easier for you, okay? Rather than to be confused, okay? So, again, I'm getting long-winded, so I'm just going to go ahead and wrap this one up. But, never fear. I can't wait till tomorrow. Quiz Friday. I'm so excited. Okay, so remember, I'm going to incorporate all this aftercare stuff so that we can start working through it. So you'll have the weekend, Friday and the weekend to look at it, and then Monday we'll give the answers. So, but again, guys, this is my opinion. I'm a veteran coder, and these are some of the things that have made things in life easier for me. So I try to pass that knowledge on, because I think as coders, we should help each other, and I always try to come up with a reference too, because I've learned in my past not to just take people's word for things, okay? Because sometimes how people interpret something can be completely different from somebody else's interpretation. So always be sure that if you're following somebody's advice, that they're giving you their reference, okay? So that's why I always try to cite the source, you know. So, okay, so I will go ahead and wrap this one up. But if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. All right, well, have a great evening, everybody. I'll see y'all tomorrow. Bye.